Let's talk about STIs in general and what's going on with them in Georgia. What is an STI? Although the terms sexually transmitted infection and sexually transmitted disease are used interchangeably, there are differences. There are many more STIs than STDs, and not all STIs result in STDs. 1 in 5 people in the United States have an STI. Many do not know it. Almost half of all new STIs are among those aged 15 to 24. STIs can be passed in 2 ways: skin-to-skin contact in the underwear zone, and contact with infected body fluids such as blood, semen, or vaginal fluid. You can get an STI from vaginal, oral, and anal sex. STIs can be a bacteria, virus, or other organisms. Bacterial STIs can be cured by treating with antibiotics, but any damage done is irreversible. Viral STIs can be treated, though not with antibiotics, but not cured, and will remain with you the rest of your life. The most common bacterial STIs are chlamydia, gonorrhea, and syphilis. The most common viral STIs are human papillomavirus, herpes, hepatitis, and HIV. How does Georgia rank in this STI epidemic? Georgia recently saw a 14.3% increase in all STIs, with the highest rates among females and youth aged 14 to 24. Georgia ranks 5th in the U.S. for chlamydia cases, 15th for gonorrhea, 4th for syphilis, and 3rd for HIV. Let's look at each of those. Chlamydia is the most common bacterial STI. Gonorrhea has high infection rates in teens. Most women with chlamydia and gonorrhea don't have any symptoms. Untreated, they can cause serious and permanent health problems in both women and men. In women, both can cause pelvic inflammatory disease, or PID, which can lead to infertility. Both are diagnosed with a urine test and treated with antibiotics. Syphilis, if untreated, can produce tragic results like blindness and death. Symptoms of syphilis in adults vary by stage. In the first stage, people can have a sore in the genital area that usually heals. Skin rashes are a sign in the secondary stage. Most of the time, a blood test is used to test for syphilis, and it's treated with antibiotics. Initially, HIV patients suffer from generic flu-like symptoms. HIV is incurable and requires ongoing treatment. If left untreated, HIV can lead to early death. Having other STIs increases your risk of getting HIV. Chlamydia, trichomoniasis, genital herpes, and HPV accounted for 98% of all prevalent STIs and 93% of all new STIs in 2018. Let's talk about trich, herpes, and HPV. Trichomoniasis, also called trich, is caused by a parasite. About 70% of infected people don't have any signs or symptoms. Some people have itching, burning, or a fishy odor. Some have a white to green discharge. It is diagnosed by a urine test and treated with antibiotics. Herpes has 2 types of virus, oral and genital. More than 1 in 6 people in the United States aged 14 to 49 have genital herpes. Most people have no symptoms. Some people have breakouts of painful sores in the genital area. Even without signs of the disease, herpes can still be spread to sex partners. There is no cure, but there are medicines that can prevent or shorten outbreaks. Human papillomavirus, for HPV, is the most common STI. Nearly 1 in 4 people are infected. Many have no symptoms, and it's incurable. There are more than 40 types of HPV. HPV is passed through contact in the genital area, as well as the mouth and throat. Potential health problems include genital warts, cervical cancer, and it's responsible for 70% of mouth and throat cancers in the United States. There is a vaccine for young people that is effective in preventing infection by the strains that can cause cancer. If you are pregnant, STIs can be more serious, even life-threatening for you and the baby. Ask your doctor for testing. If considering abortion, it's important to get tested and treated. STIs can be spread during the abortion procedure, putting you at greater risk for serious health problems. How can you prevent STIs? The only way to prevent STIs 100% of the time is to not have sex. Condoms are ineffective part of the time for preventing STIs in pregnancy. During outbreaks, HPV, herpes, and syphilis can be passed by skin-to-skin contact, so condoms don't help. Other birth control methods do not prevent STIs. Some hormonal ones can increase your risk of getting an STI by changing your vaginal pH. Let's look at how the number of sex partners increases your risk of STIs. When you have sex with someone, it's like you're having sex with everyone they have had sex with for the last 10 years, and everyone they and their partners have had sex with. Say you have had 5 partners. If you assume they have also had 5 partners, you have been exposed to the STIs of 31 people. As you can see, the numbers go up quickly. So for 10 partners, the exposure is 1,023 people. Do you want to take a break from sex or set some relationship goals, but don't know where to begin? To take control of your sexual activity, you can define boundaries up front with your partner, never be alone in a room with them, call a friend when you feel tempted, limit your internet access, develop ways to say no and practice them, tell others your plan, and check in with us. We can help. Let us help you with information on how to have a healthy relationship leading to marriage. Contact us today.